It's Dr. Eric Balcavage, and I'm back for another edition of Thyroid Thursday. And today I want to clear up some of the confusion regarding hypothyroidism and a term that I use that I say thyroid hormone dysregulation disorder. And so in the last series of Thyroid Thursdays, we talked about all these hypothyroid patterns. Traditionally, in traditional medicine, there really is hypothyroidism. And it's primary hypothyroidism, and there's not a big concern about running the rest of the panel or running thyroid antibodies, because really they're looking to identify hypothyroidism. And hypothyroidism technically is a situation where the thyroid gland is just not making enough T4. Remember, we said that when the thyroid needs, or when the cells need thyroid hormone, the pituitary gland releases something called thyroid stimulating hormone that goes through the thyroid gland, kicks the thyroid gland into gear to make thyroid hormone. The vast majority of it, 93% of it, is T4, which is an inactive form of hormone, and it needs to go off to the peripheral tissues, the liver, the gut, the peripheral tissues to make T3. The T3 then needs to bind to receptors on cells, and once the thyroid hormone's in the cell, bound to the receptor, then it can help regulate metabolism. Primary hypothyroidism is really what's being measured for most people when they do a TSH and T4. You really only need those two markers to diagnose hypothyroidism. And really what they're looking for is the thyroid gland making enough T4? If it's not, then you're diagnosed as hypothyroid and you're given thyroid hormone. The problem with that is it assumes that once you give thyroid hormone, that everything downstream is going to work. And we know that that just isn't the case. There's so many places where thyroid physiology can break down or get bogged down that just because you put thyroid hormone into the system, T4, doesn't mean it's going to be converted. Just because I tell my kids to do their chores or to do their homework doesn't mean they're going to go up in their room and do it. They could be watching videos on their iPad or on their iPhone instead of doing their homework. So I wouldn't assume that just because I told them to do it, that they're going to do it. Just as you and doctors can't assume that just because we dump T4 into the system, that it's all going to be converted into T3 and everything's going to work the way it should, and all that hormone's going to get to the cells and it's going to get into the cellular system and it's all going to work. There are cofactors, enzymes, multiple steps that have to occur, and there's a lot of places where thyroid hormone physiology can break down and often does. So what I term thyroid hormone dysregulation disorder is a situation where TSH is maybe normal, T4 is maybe normal, but there's problems with the physiology. And if you remember from the segments I've done in the last couple weeks, we talked about steps or the patterns 2 through 7 were all thyroid hormone dysregulation disorders where the thyroid T4 values may have been okay, but the steps past T4 were breaking down for some reason or the other. If you don't run a full thyroid panel, you'll never see the rest of these thyroid hormone dysregulation disorders. You just won't see them. So what gets measured gets managed. When only TSH and T4 get measured, then that's all you manage is there enough T4 in the system? I think there's plenty of research at this point now, plenty of documentation to say that there's multiple ways thyroid physiology can break down, and we need to look well beyond T4. That's a 30-plus-year-old model of understanding of thyroid physiology. You need to understand what's happening through that full pathway. So, what do you need to do when you talk to your doctor? Don't get mad. Traditional medicine says really all you need is a TSH and a T4 to diagnose hypothyroidism, and that's all they're diagnosing when they run those tests. You really want to push for a full thyroid panel that we've talked about on other Thyroid Thursday videos. You've got to run TSH, T4, free T4, T3, free T3, reverse T3, T3 uptake, and the thyroid antibodies. And so you want a full thyroid panel. You also need to find a functional medicine practitioner who understands the whole thyroid physiology pathway and all the things that could compromise it, like micronutrient deficiencies, like B vitamins and selenium deficiencies and zinc deficiencies. You need to understand immunity and gut physiology because, as I said in one of the previous videos, autoimmune thyroid disorder is the #1 cause of hypothyroidism symptoms in the United States. So if you're struggling and you're really frustrated with trying to get your doctors to run full panels and they're not talking about the rest of these thyroid hormone dysregulation disorders or patterns, it's just because for many of them, it's not what they've been taught. It doesn't fit the medical model of it's either the thyroid gland's either working or it's not. In primary hypothyroidism, the thyroid gland is not working. In the thyroid hormone dysregulation disorders, the thyroid gland is working, but somewhere else in the pathway is disrupted. One last point, even if the person is hypothyroid and their gland is not making T4, we can give somebody, or a doctor can give somebody T4, and that will give them the T4 that their thyroid gland isn't making. But we should be asking one more question, and that is, why is the thyroid gland not working? It's not just because you're older, it's not because you turned 40, there's a reason for it. And that's why functional medicine practitioners tend to dig into it a little bit more, because we want to know the underlying reasons why the thyroid's dysfunctional, not just diagnose that it is dysfunctional and give thyroid hormone. We want to understand the reason why it's dysfunctional in the first place and see if we can't fix that. Maybe there's tyrosine steal going on where tyrosine's not getting to the thyroid gland. Maybe there's iodine deficiency. There's multiple reasons why there could be breakdown in the thyroid gland's ability to make thyroid hormone. And in functional medicine, that's really what we're looking for. So I hope this has helped. If you're struggling with your thyroid condition and you need help, you can always give my office a call at 610-558-8920, and you can always leave comments below and I'll get back to you as quickly as possible. I look forward to giving you some more information on next Thursday's Thyroid Thursday. Take care.